The steak night song was to be sung every steak night and had been for the last decade.
We're gonna steak night, we're gonna eat it right. Steak is such a treat, it is the world's best meat.
You might recall that little refrain from the TV medical sitcom Scrubs, but forget steak night. According to a new study, which basically says all red meat is bad for you, a long-term study finding that eating any amount, any type, increases the risk of premature death. Let's see what local experts are saying about that. Joining us again this morning, Dr. Glenn Eisen. He's a gastroenterologist from the Oregon Clinic. Doctor, what's your take on this new study?
Well, I wouldn't have everyone rush to their refrigerators and throw out their bacon just yet.
Tell us why.
Well, the reason is this is a very well done study, but it is a prospective observational study in which they follow thousands of patients, over 100,000 individuals. They're in two separate studies, and every 4 years they ask them about their diet with a very intensive questionnaire. And if you ever had this questionnaire administered to you, you'd realize how easy it is to make errors and misclassify what exactly you're eating. It's, they're asking you what you had for lunch 3 years ago, essentially. Mm-hmm. So it's hard to know. I think the general take-home message from this is that, for the most part, eating excessive amounts of red meat cannot be good for you. And in this study, individuals that had at least a serving every day were between 13 to 20% more likely to have premature death, either from cardiovascular disease or cancer over the 20-year course of the study.
One of the statements from the beef industry, a spokesperson said this: there are several randomized control trials which have convincingly shown that lean beef, when included as part of a healthy, balanced diet, improves heart health by lowering cholesterol. Is that true or not?
That's true, but which do you care more about, lowering your cholesterol or dying a premature death?
Can I have a minute to think about that?
Yeah. Sure. Well, no, I mean, I don't mean to be flip about it, but that's a surrogate marker for a bad thing happening. All of these things, eating red meat, having elevated cholesterol, having hypertension, they all either increase or decrease your risk of bad things happening to you down the line. It's interesting. I've had patients who were vegans who had a screening colonoscopy, and they had lots of polyps. One even had cancer. And the patient said, how can this be? I eat perfectly. I do nothing wrong. And the point is, it can just change your risk. That doesn't mean that something's going to be bad will happen to you even if you eat bacon every day. But I think the take-home message is that you should moderate your amount of meat intake. And if everyone would cut back their beef intake by 50%, the general health of the U.S. would be much better.
Dr. Eisen, what can you eat to facilitate a reduction in mortality risk? Is there something specific we should have in our diet?
Well, I think, just as you're cutting back on your calories from red meat, the study shows, and they did this through some mathematical modeling, that if you replace the calories from the red meat with nuts or beans and lentils, grains or fish or even poultry, your risk decreases. So it's not just a matter of what you don't eat, it's a matter of what you do eat.
I'm ready to answer that other question you raised. I'd like to stay alive. The cholesterol thing's not that important to me. But anyway.
It's just an indirect measure.
There are many Americans, as you well know, Dr. Eisen, who might have bacon in the morning and a burger at night. I assume now that should be rethought.
It should be rethought, but, the Americans are very slow to change their health habits. I think if people had more of a grain and fruit and vegetable-based diet, they'd probably feel better. If anything, there's some studies showing that actually it's less expensive. But I don't think that this should mean that no one should be eating red meat anymore. I, in fact, eat red meat rarely, but I enjoy it, and there's nothing wrong with that. But I think that eating it several times a day or every day is probably not a good idea. And the editorial that accompanied this paper was written by Dr. Dean Ornish, who feels very strongly you should never eat meat. But he suggested that perhaps you should just, as a start, try meatless Mondays. 1 day a week where you don't eat red meat.
Dr. Glenn Eisen with the Oregon Clinic. Always a pleasure to talk to you, Doctor. Thank you very much.
Thanks. Enjoy your cheeseburger.